Last month, it was revealed the Chancellor of the Duchy of Lancaster, Michael Gove, said the government was looking to open discussions on so-called COVID status certificates. A number of ministers have previously rejected the notion of vaccine passports, but proponents of the scheme argue it could help lower COVID transmission rates and assist with the easing of the lockdown. But critics say it could infringe on people's civil liberties and punish those who refuse to get the jab. Well, I'm now joined by data security expert Jamal Ahmed. Jamal, afternoon. Thanks for being with us.
Thank you for having me, Bill.
Well, the government needs to know who has been vaccinated to keep us all safe, and a centralised database seems like a logical idea to keep track of the information.
On first thought, it might sound very logical, but if we pay a little bit of closer attention, we can see that it's actually very illogical. And secondly, this government cannot be trusted to hold our data. First of all, let's look at the logic of it. So whether someone's had a vaccine or not, it doesn't affect the transmission rate. Whether you've been vaccinated or I've been vaccinated, if we were both to come into contact with someone who has the COVID infection, we could easily catch that and we could pass that on. And because we've been vaccinated and we have something to prove it, we could potentially think we're safe and other people will think we're safe. But actually, we'll be responsible for spreading that to more people, and those people will go and spread it along to more people. And in fact, it could actually be doing more harm than good. Having a jab doesn't actually make it any more safer for someone transmitting that virus. All it means is if you was to contract the germs or contract the virus, you are less likely to be hospitalized for it. It does not in any way reduce the transmission rate.
Well, we
for that
don't
reason,
know about
it's
that, don't we?
very
Because we
logical.
do get conflicting views on that. Some are saying it's up to 70% reduction in the chance of you passing on the infection. And I suppose there's still a lot of data and research to be made about just how infectious you are after getting that vaccine. So that's still a questionable area?
It's still very questionable. I mean, there has been no proven results. There's been some speculation. This 70% it's come out of thin air. It's not
All right, apart from the medical
studies.
reason that you're saying, what about the idea that this data can't be trusted by being held by the government?
So there's two things here. Number one is that we know this government has a history of failing to protect data. They couldn't keep data safe in Wales when it came to the National Health System. They couldn't keep data safe when it came to recording COVID tests, and they used an Excel spreadsheet and lost 15,000 results. And in fact, we've seen more recently, earlier this month, that they can't even send an email without blind copying the people receiving the email, and they can't be trusted with that data. Dido Harding has spent how many billions of pounds trying to get a grip on this data, to get a handle on this data with the COVID-19 pandemic, but has really failed. And what we can see is if this government is going to be collecting data for centralized purposes, there's going to be purpose creep. And David Davis, this is what he spoke about in the comments. He's talking about purpose creep is, yes, we're saying we're going to collect that for this COVID right now, but we're going to see purpose creep. And eventually it's going to become a national ID card, which is what he and a lot of people in this country are against. And secondly, and more importantly, is by collecting or by having this kind of system in place where you have to prove whether you've had a jab or not to get access to certain places, it can actually indirectly discriminate against a lot of people. So for starters, people that are younger in our society are less likely to receive the jab, and it's likely they're going to have to wait a long time. So we're indirectly discriminating against people because they seem to be younger and they're less at risk. We're also discriminating against people who might have religious beliefs. For example, the AstraZeneca jab includes something from a chimpanzee, and a lot of people have religious beliefs where they're worried about taking those things. So we could indirectly be discriminating against people because of those beliefs they hold. Now, whether I or you or anyone else holds those beliefs or not, in this country, we have the freedom to have such beliefs and not to be discriminated against. And furthermore, when you think about Convention 108, which we signed over 20 years ago, that guarantees that our health data will not be used in a way by the state to discriminate against any individual person based on those health grounds.
But you really do wonder whether the fact that I or you have had a vaccination, that data saying, yes, they've been vaccinated, but how harmful could that information be? I mean, can it really get into the wrong hands? How can it be? I know that David Davis and you have said that this could be one step towards a national identity scheme, but you would think that simple fact about a person is pretty harmless.
Well, it might be pretty harmless on the face of it. However, this kind of information could actually be very useful, especially for people looking to target certain people based on whether they've had the jab or not. So, for example, I was doing a piece of research as part of the Privacy Pros Academy earlier today, and what I've noticed that the travel agencies are looking to target people over 50 for summer holiday trips because they know that they're more likely to have had those jabs. Now, if they could get that information from a national database, that data becomes very powerful to them. We already know data is a lot more valuable than oil, and that data, a lot of states, a lot of organizations would actually hold this government to ransom for that data.
Okay.
And earlier this decade, we saw how the NHS was attacked and held at ransom because of the data they held. Now, this data could come to a standstill, and it could be very vulnerable, and the kind of risks and the people interested in attacking this data would really be a public target number one.
But it is important, isn't it, when we look at the amount of deaths, that something has to be done. I know it's a contradiction whereby a lot of people say, well, we've had an infringement of our human rights in terms of lockdown. Some believe that. But when it actually comes to a vaccine that could obviously make life return back to normal, you can understand the appetite for people saying, let's just get on with that because privacy really doesn't matter at this stage.
Well, whether someone believes that their right to privacy matters or other people's right to privacy matters or not doesn't necessarily mean that people should be coerced into getting the jab, because it explicitly discriminates against people who have not been vaccinated. And therefore, whether you value your right to privacy or not, we have to value other people's rights to their beliefs and their choices on whether they want to get this jab or not. And by having this kind of system in place where we have some kind of a green passport, you're coercing and forcing people that would otherwise want to make the choice of not having that jab by excluding them from society, by potentially excluding them from restaurants and gyms. Now, let's take, for example, a family that goes out to dinner. They may have people from 3 generations. Do they now have to sit separately, or some people going to be excluded from those family celebrations because the younger ones haven't joined the queue or it hasn't been their turn to get their jab yet? And at the same time, what we've seen is that it's created an economy on the dark internet, which the BBC reported earlier today, about how people are offering fake passport certificates, fake jabs to people on the darknet. So how much can we actually trust this data? And is it really wise to create this darknet economy where they're selling these passports and selling these jabs, and we'd have no idea whether those jabs are actually genuine and legitimate or not?
Jamal, good to talk to you on this. Thank you very much indeed. Jamal Ahmed. And that's it for the moment. I'll be back with plenty more news for you.